In this video, I will discuss very important complication of surgery, that is postoperative fever. Postoperative fever in a surgical patient can be caused by a variety of factors. These causes are often categorized based on the timing of the fever's onset and can be remembered using the mnemonic 5 W's: wind, water, wound, walking, and wonder drugs. Here's a detailed breakdown of common causes. Immediate postoperative fever within the first 24 hours. 1. Inflammatory response to surgery. The body's natural response to the surgical trauma can cause a mild fever. 2. Blood transfusion reaction. A febrile reaction can occur if the patient receives a blood transfusion during or after surgery. 3. Medications. Certain medications or anesthetics used during surgery can trigger a fever. Early postoperative fever. 1. 3 days. 1. Atelectasis, wind. Collapse of lung tissue, often due to inadequate deep breathing or coughing, can lead to fever. 2. Aspiration pneumonia. Inhalation of gastric contents or oral secretions can cause lung infection. Intermediate postoperative fever. 3. 7 days. 1. Urinary tract infection. Water, often related to the use of catheters. 2. Wound infection. Wound. Infection at the surgical site marked by redness, warmth, and discharge. 3. Thrombophlebitis. Walking. Inflammation of a vein, often related to IV lines or central venous catheters. 4. Pneumonia. Bacterial infection in the lungs, particularly in patients with impaired mobility or underlying lung disease. Late postoperative fever, more than 7 days. 1. Intra-abdominal abscess. Collection of pus within the abdomen, often due to leakage from the gastrointestinal tract or infected surgical site. 2. Deep vein thrombosis, DVT, pulmonary embolism, walking. Blood clots in the veins, which can travel to the lungs and cause a pulmonary embolism. 3. Drug fever, wonder drugs. Fever as a side effect of medications such as antibiotics or other drugs administered postoperatively. Other causes. 1. Gastrointestinal infections. Infections due to Clostridium difficile or other pathogens, especially after antibiotic use. 2. Sinusitis, particularly in patients with nasogastric tubes. 3. Prosthetic infections. Infection related to implanted devices such as joint prostheses or pacemakers. 4. Endocarditis. Infection of the heart valves, particularly in patients with predisposing heart conditions. Diagnostic approach. When assessing a postoperative fever, healthcare providers consider the following: patient history and physical examination, a detailed history of the surgery, any invasive devices used, and overall health status. Laboratory tests, blood cultures, urine cultures, and other relevant cultures to identify infection. Imaging studies, chest X-ray, abdominal ultrasound, or CT scan to identify sources of infection or complications. Management of postoperative fever involves treating the underlying cause, which may include antibiotics for infections, anticoagulation for thromboembolism, removal or change of catheters, and supportive care for symptoms.